This is a video about acute crisis, what it is and how it can be helped. We will cover what is acute crisis, how do you treat it, and what you can get out of therapy. So what causes an acute crisis? Acute crisis is the term used for your body's response to severe psychological events. A loss, or even a threat of a loss, can create this reaction. Firstly, it is not the same as what is known as a life crisis, but is used to describe the effect when you have been subjected to a violent, unexpected event or incident. When this happens, your body and your mind can react in a wide variety of ways, and it's best if you do not try to suppress or dismiss these. You might suffer any or all of these at different times: nausea, dizziness, headache, stomachache, sleeping difficulties, lack of concentration, concern about others and a fear of loss, and a feeling of unreality, like being in a film, or that you are watching events happen from the outside. So what can one do to help? There are two phases. First, the acute phase, and then, secondly, as the fallout continues after the acute phase. And different actions help in the different stages. We will also look at how therapy can help. In the first phase, the acute phase, you shouldn't be alone. You should not drive a car, and don't feel like you have to talk about it if you don't want to. You might find a game or other distraction useful, or something else to help you sleep. After the acute phase, you may find you want to tell the story over and over again. And this can be a good thing, so that you eventually disconnect from those emotions. Try to maintain your daily routine, as this will help you to reconnect with normal life. You may need some time off work, but go back as soon as possible, even if for only a short time a day, or for restricted duties. Do be careful of retreating from the world, allowing anxiety to overtake you, or avoiding issues and difficulties. How can therapy help with acute crisis behavior and problems? A therapist will encourage and support you in examining and forming a complete picture of what happened. With a therapist, you will be able to face the event, even revisiting the location. Your therapist will be able to watch for and help you to cope if anxiety or avoidance become a problem, and teach you techniques that help to calm and distract if the occasion arises. Your body will slowly accept and understand that the crisis is over, and you can learn to relax again. Thinking about or dealing with the event will eventually come to take up less time in your life. You will learn to cope with crisis triggers without serious consequences. You will in time be able to talk about what happened without being overwhelmed by emotions. You may never be the same again, but you'll be fine. Do something about your acute crisis. It can get better.